didn't have anything to do, and they kept coming up and saying, what can we do, what can we do? We couldn't hire the clock house, we couldn't do anything. Then all of a sudden we got it back, and Well London came onto the scene, and that was the best thing that ever happened.
You are actually helping yourself mentally instead of being isolated in your house. And some people suffer from depression as a result of being isolated, just staying indoors, nobody to talk to. You find out while doing this, you're helping yourself.
That ultimately saves NHS money.
Greenwich was involved with Well London in the first phase at the Barnfield estate. That community really embraced the Well London approach. The evaluation showed that there was huge improvements in self-reported health and well-being. One of the things we learnt from Barnfield is that the coordination was really important, and our coordinator in Barnfield was key to bringing that community together.
When I meet them, they are in their environment where they're just dropping the kids at school, or they're home not doing anything. And so the Well London delivery team is a forum that brings people from the community out where they can connect, communicate, and find out what's happening in this neighborhood.
The other thing we learnt really from phase one is how key it is to bring local partners into the project as well.
Well, I'm in a lucky position locally because I'm based in public health, and so I have access to public health. And so some of these projects, initially my first thought is to approach the different teams who deliver projects from public health. So for example, the Royal Society of Public Health, I will contact the community health team, the cookery club team. I will look at Greenwich Active, who does a lot of physical activities programs in the borough.
I work for Charlton Athletic, and I was drawn into Well London's delivery along with the YMCA, a local youth club, so that the young people weren't forgotten about.
With community health, they support the Well London program in delivering that here on the delivering activities here on the estate. We haven't had to pay them to deliver that training, and so by doing so we're able to get in kind in different aspects to help add the capacity of the Well London work. Many of the volunteers have come from different background, either that they've been in work before or have been at home looking after the children, and they're looking to be upskilled to go back into work.
There's always a potential for anybody that joins the Well London delivery team. There's always the potential to learn new things.
We all think we know what it means to live a healthier lifestyle, but until you really go through a really formal training, you walk out from the cookery clubs thinking totally different of how you're using your salt and your cooking oil, and how you could be recycling food and just cooking a much healthier diet for the whole family.
Now I watch what I cook, honestly I do. So salt is almost no salt in the food.
And also we learned that you don't really need much oil in your food, because at times, from where I come from, when we cook, we put so much oil that you have to drain the oil at times, so we eat a lot of oil.
You're able to get the volunteers to do these training, it then impacts on their family. So they change some of their behavior in terms of what they eat and how they cook, and increases their physical activities. It impacts on the whole family, and then that family might then spread the word to another person who then come along, and again it benefits another family.
You're really looking at the positive assets that are in the community, things like a community centre, but also the people that are living there, and it shifts people's thinking into from a problem to what the solution is.
Well London actually have done very well. They did a number of training courses which residents could go on to. It was called Dare to Dream Idea, which was a 7-week course. And at the end of that 7-week course, you had to put an idea there what you wanted to put £500 towards.
This area that we operate in is one of the poorest areas in London, and so to be at a stage where we have on our books 35 volunteers, where at a stage a year and a half ago we had less than 10 people in the room who was really skeptical about whether we can get more people involved, whether we can get more support, whether we can get that community spirit going. We have the community garden project that's just started, and it's really at the heart of the community. It's one of the projects that they're passionate about.
And the ideas coming from them are really important. So, for example, with the gardening project, the land we're using is owned by the community centre, and they've given permission for that to happen and to continue.
They said they wanted something so that we can engage the men, and so we've then, we're working with Age UK to do the men in shed hair on the estate. It's really, really amazing when you meet people and where there's no self-confidence, where they're not aware of what's available for them in the neighborhood. Once they engage, they're able to be feeling much stronger, much healthier, to take that gradual step to go back into work or go back into learning.
Having it organised through GLA means that you've got that brand, that shared branding and identity, which is really important, and people feel that they're part of something bigger.
We are collectively together. That's what I think the Well London's fund. It's not misplaced at all. It's money well spent.
It's an approach that you can prove and show other outcomes beyond the health and wellbeing outcomes, and for a local authority that's really important to be able to deliver across different priority areas.
We have a cafe in this building which is closed and it's not open, and the people who have lunch club here in this building don't have access to the kitchen, and so we have invested a small pot of money to start a conversation, a feasibility study to see how can we reopen this kitchen and how can we make it a functional kitchen where we can have a lunch club for residents here in the neighbourhood.
When the Well London funding finishes and the project finishes, they're real sustainable, real things for people to continue being involved in.
I know there's been conversation with Councillor John Fahy and different forums about how we can sustain this work, and I know Public Health are very keen to have a presence here and to continue support a lot of the work that the Well London approach and model has brought to the area.
That sort of partnership working that Well London lends itself to shows that the voluntary sector, the third sector, can deliver on the outcomes that the local authority are looking for.
We really would like Well London to showcase this community, to show what it was like before Well London, what it was like, once the Well London model has been, operating here on the estate, and to let the funders know that their money was well spent.
We're also looking at how we can use the Well London approach to do more work on a ward level basis. Certainly I think the Well London programme and the successes we've had both at Barnfield and the Woolwich Dockyard is helping us and informing that discussion.